Good morning. Here are 3 exercises. The first 2 were for the hips and the last one was for the knee. So post surgery, investigations into the knee, sometimes the back of the knee, that little muscle called popliteus, can do some peculiar things. So the first one is just to make sure that's stretching in rotation and flexion extension, and then we'll get on to the hips. So let's start with the knee. Now, if you pull the foot all the way up towards the shin, you're going to lock the ankle out, which means you can't just move the ankle. When you move it now, we've got to come all the way up through the shin, and you can probably see those tattoo marks there start to rotate. So what we're going to do is this. We can do it both ways, so don't worry which way you go to start with. But you keep the thigh where it is, toes up, rotate the shin so the toes face inwards. Then you're going to open the knees, so extend the knee, but not quite to full extension. When it gets to full extension, the joint locks and then it moves as one. We want to still move the knee joint. So from there, we rotate the shin outwards and then bring the heel back as far as it will go. So rotate in, come up, not quite to full extension, rotate out without the thigh following, pull it back in. You can do a few that way, then you do the opposite. So you just rotate out, near extension, rotate in, pull it back. Just like so. And we're looking just to get everything moving around here. So that popliteus muscle, which also can inhibit that straight leg raise. So as you're lying on your back, lifting your leg up, if it doesn't go up as high as the other side, that might be an area which is worth looking at. Second one, we had the hip. So the 90-90, this is for the back of the hip capsule. So again, if you struggle flexing that hip, it can sometimes be because of this. So we've got a few options, but essentially the basic one is this 90-90 position. So the front leg, shin pointing up. We've got the tibia pointing directly out to the side. And again, back leg going out to 90. And again, 90 degrees at that knee. So the foot's pointing straight backwards. Now, if you've got a lot of external rotation in this hip, it will allow your pelvis to come all the way back down and your spine to stay straight. Problem is, not everyone does. I don't. So ways to take stress out of the back from having to move so you can just keep it focal to the hip. One of them is to take your hand further out. So if you think about my pelvis, if I haven't got enough rotation there to get my pelvis to horizontal, my spine has to finish it off. So if I can take my spine so it comes out at 90 degrees from the pelvis, there's no strain through the spine at that point. The other way to do it, if you've got a bolster or something like, or a foam roller, non-foam roller, you put it in and you sit side saddle on it like this. So all that does now is, instead of taking myself out this way, I've brought the floor up to meet me. So it does the same thing, just a slightly different way. Then you can keep your spine up straight because you don't need to compensate. From there, keeping the back straight, just bring the navel forwards. And that back straight bit is important. If I turn sideways, if there's forwards, and you might be able to see, if I think I need to get further down and it's not coming from the hip, I start to flex the spine, which has got absolutely nothing to do with rotation of the hip. So we've come forwards, navel forwards, back straight. Then I think about pulling this front thigh backwards into the hip joint. It's not going to move, but that little bit of traction will make the difference. And then if I imagine I've got a torch between my buttocks, I want to shine that torch up the wall behind me. Again, it's not massive movement, but that little, call it an anterior tilt, will just increase the load into that hip. When you've found the sweet spot and you've got no discomfort in your back, just start to drive this leg down into the floor. So I imagine I've got some of those big old scales which you used to have at boots to weigh yourself on. This is the pad at the bottom, and as you gently start to push that leg down onto the scales, imagine the dial coming up, but I want it to come up smoothly. So instead of juggling up, just gently start to increase the pressure. And then when you get to the percentage you want, and it can be a low level one, 20%, all up to 100%, but start low to begin with. Hold that for about 10 seconds. 3, 2, 1. And then from there, all you're going to do is increase that stretch a little more. So you can pull the hip back, take the navel forwards a little bit, tilt your torch up the wall behind you, and we're just doing minuscule bits there to bring you a little deeper into that stretch, as long as it doesn't feel uncomfortable. The last one, and you can do that on both hips. The last one is for your hip flexors. So various ways to do this one, but in the absence of me, I will put your knee on a cushion and maybe put your foot on a sofa or something behind you. You can either use sticks, or if you've got a chair in front of you, you can use that to stabilise. So if I'm stretching my right hip flexors, I have my left foot forwards. So you've locked into position. If you've got a belt buckle on the front, I want you to think about bringing the belt buckle up, which we call a posterior tilt of the pelvis. So the whole pelvis is doing that. Which will increase the stretch down into the front of the thigh. Now, from there, keeping that up and not arching your back, you've got a couple of options. One is to start pushing that foot down, and that will, even though it's not going to go anywhere, that's going to start firing up all the muscles in the front of the legs. You can hold that for 10 seconds. Then locking on and not moving, you're going to try and pull your heel towards your bottom. Now, if you're already in the stretch, it's not going to move, but it will go light on the chair behind you, and your whole hamstrings will start working and quite possibly cramping up, which means you're doing it beautifully. Hold that one for 10 seconds, then you can relax and you can just come into that stretch again, put the tilt on the pelvis, maybe come forwards just a tiny little bit to build that stretch. So, 3 exercises for the hips and